So if you are perimenopausal, menopausal, postmenopausal, and you are a type 1 or type 2 diabetic, yes, it increases your risk of frozen shoulder. If you don't know, I'm Dr. Wendy. I'm a physical therapist. I've taken care of women for 20 years. And as a women's health specialist, I love to work on all the things that happen to women. And frozen shoulder happens to women. Now, frozen shoulder is a really quirky, weird thing. It's orthopedic, but it has a little bit of an insidious onset, meaning it has a chemical hormonal piece to it. So if I have a patient who is having a weird shoulder reaction, meaning I'm ranging their shoulder and all of a sudden their range of motion goes down. They don't let me stretch it. They're guarding, they're protective, their pain is off the charts. I'm instantly referring them back to their doctor, making sure they report those symptoms and asking them to have blood work done to check their thyroid and do they need to address their hormone issues. Now, my partner is a type 1 diabetic. I am well versed in diabetes and what it does to your skin and your connective tissue. Diabetes basically makes you a slow healer. Slow. So if you have thyroid issues, you're postmenopausal, menopausal, and you're diabetic, yeah, if any of those things get out of balance and maybe you are having shoulder pain and you kind of stop moving it, it can come for you again and again and again. But if you recognize the early signs, you can get ahead of it, meaning get your blood work checked, address what's happening. Start doing your gentle passive range of motion. Start heating it. Look at what you can do to control your inflammation because those things matter. Now, some of my patients will get a steroid pack. Sometimes they get a steroid injection into the shoulder, which is really quite helpful, but you have to use steroids sparingly. You know, if you had just taken a steroid pack for COVID a month ago, you can't take another steroid pack for 5 more months. I think it is wise to not take a steroid pack too often, no sooner than every 6 months because steroids will break down your tissue, but steroids are needed. Injections into your shoulder, you can only have so many, but frozen shoulder is really awful, and that is a really good thing to get a steroid shot for. So having a conversation with your doctor, being real about your symptoms, fighting hard to not get it again. So prevention-wise, staying on top of your diabetes, keeping your A1C as low as you can have it, and doing a daily shoulder mobility routine is one of the best things that you could do to prevent it from happening to you. Hit the plus sign and follow for more women's health.